Being someone who's struggled with mental health themselves, knowing the importance of just having someone to talk to and work through problems with really like started the fire in me to be that for someone else. MHTR stands for Mental Health Treatment Requirement, is a part of a community order. So individuals who have committed a crime that fall in the community sentence range, who have low to moderate mental health needs, they are able to be assessed for a period of 8 to 12 therapy sessions, which is given by an assistant psychologist, which then is supervised by a qualified. We talk to them a lot about their life before the offence, as well as the offence, to determine that link. That's quite a big factor in us looking at suitability, is that we do emphasise the link needing to be there between their mental health and their offence. If you have individuals who are at risk of offending but can manage their emotions better, then it reduces the risk that they could pose to the wider community. For example, if someone is assaulted or their way of managing their emotion is violence, then if they are addressing their mental health, which might be inputting into that violent behaviour, then it reduces their risk of them acting in a violent way. If we can stop that or address that earlier, it doesn't quite lead to what it could and the potential of what it could be. We use a psychometric measure called the core to help us determine the severity of their kind of psychological distress, as well as the information they give us, determine whether we think is something that can be done out in the community and that is something of a level that we as assistant psychologists can help with. That's then overseen by our clinical lead. It's their decision on the level of suitability. What we emphasise is these 12 sessions are their sessions and it's how they want to use it. We make a treatment plan which is tailored to their needs that we see on the assessment, and we'll take it in and we'll say, you know, this is what we've kind of come up with. What do you think? What is your aim of this therapy? We'll set some realistic goals to then review maybe halfway through treatment to see if we're hitting those goals, or if there's things we might want to change, different areas we want to look at. So we are able to do that first step in trauma stabilising, where we'll look at understanding trauma and how that affects us and our behaviour and you know, our brain and things like that, and ways that we can de-escalate and use grounding techniques to manage our reactions to triggering traumatic experiences. However, because we're not trauma therapists, we can't go in to depth with trauma. So what we tend to do is we'll do that stabilisation work, and then we can signpost to onwards referrals or services that might have more specialised help for that individual. So if the mental health needs are really complex, so if they're actively having hallucinations, auditory, visual, anything like that, which escalates their risk, if it's managed by medication and not impacting their life in a severe way, then that's debatable. That's in one of those grey areas where we would seek supervision on it. However, if it's something that deems the risk too high for something that can be managed with a community mental health input, or an input at a lower level, then that would suggest not. If there's an extreme amount of self-harm, or there's really recent suicide attempts, that would raise our kind of risk flags as to if this is something that is kind of suitable for that individual there and then, or if it's their risk is going to further escalate if they're not in the space to be working on therapy. It's really dependent on the motivation of the individual, but also their insight into their own mental health, because you might spend a lot of time developing insight and kind of starting from scratch, so talking about what emotions are and how we might feel them, compared to someone who might have a lot of insight and you can just develop on that. The EP and the probation officer stay in communication about the attendance and the engagement we're getting, because ultimately it being a court order, if they're not attending, then there's a risk of breaching the order. So we need to make sure we have a good level of communication to discuss their engagement and whether they are meeting what they need to be meeting for that order. What I look for is just them reporting to me how they're feeling, and if that looks any different, or the behaviours they're engaging with, if that's changed because they have a better understanding of what they're thinking and feeling at the time before they behave in a certain way. And also, I think how I also measure it is their level of reflectiveness. So if they can come in and reflect to me to say, this is what happened, this is what I did, but in another scenario reflect back on how they might act differently. That just shows that their thinking is starting to become more advanced, and they're kind of considering their mental health in it as well. You want to know that when people are leaving our sessions, they've got people to go to, they've got the support system around them to aid their recovery. Sometimes they're in our sessions and it's a really emotive conversation, they might be feeling really heightened. Obviously we do what we need to do to make them safe before they leave us. However, it's so fundamental to their recovery that they have that support network of their friends and family around them, their interests, that they can go out. You know, sometimes people will come and say, I'm going to go for a run after this, Anya, just to clear my head. Or, you know, they might say the importance of exercise in maintaining positive mental health. We want them to be able to access that. Also, looking at it aside of being in the community, we say that, you know, they need to be registered with a GP. That is an essential thing with our MHTR, and that's because we want them to have access to, you know, onwards formal assessments for things like ADHD. We see a lot of people come through with ADHD like symptoms, and once we've looked into it, they might feel like, you know, that's something they want to explore with their doctor. So having that avenue in the community is so important and so fundamental to how they are going to recover and how their mental health might deteriorate or might change, because without that they're left really alone. I've got a client who has a long history of being in and out of custody, so he's spent quite a lot of the last 20 years in and out of prison, and he reflects back on how his experiences then compared to now has really changed. And I use a lot of compassion with him to kind of show him the progress he's been making. He when he was in prison, the psychological intervention he had was medication, which didn't quite work for him, and along with substance use, that escalated everything for him as well. And I think what we've seen since he's been engaging with me is that he's having the space to talk about his feelings and talk about his past in a way he hasn't before. So he's left sessions having a better understanding of himself and how his anxiety works, and ways that previously his anxiety would have caused him to kind of really escalate and his substance use to get even stronger and more powerful for him. However, now he's able to really reduce his substance use. He's able to find other things that are keeping him busy and helping with his mental health. And then coming into our sessions, he's really reflective of how custody and being in and out of prison kept him really unstable, and really, you know, he often found times when he was back in prison because he had nothing else to kind of do or anything else going for him. But now being in the community he's been out for a couple of years, he knows that the consequences of what could happen if he were to do anything now is a lot greater, that he's not willing to sacrifice. And that comes in prison really deteriorating his mental health as well, and he acknowledges that and can kind of see the difference between the community and prison now.